السلام عليكم ورحمة الله وبركاته. شلونكم طلاب؟ إن شاء الله تكونوا بخير. محاضرتنا اليوم هي على lymphatic drainage of the head and neck. Lymphatic drainage of the head and neck, it can be divided into regional groups, which are occipital, retroauricular, preauricular parotid, buccal or facial, submandibular, submental, anterior cervical, superficial cervical, retropharyngeal, laryngeal, tracheal, which are pre and paratracheal lymph nodes, and their terminal group, which are deep cervical lymph node. The classifications of lymph node, which are upper horizontal chain. These are upper horizontal chain, which compose of submental lymph nodes, submandibular lymph nodes, parotid lymph nodes, postauricular lymph nodes, and occipital lymph nodes. Lateral cervical lymph nodes. Lateral cervical lymph nodes. This includes nodes superficial and deep to the sternocleidomastoid muscle and in the posterior triangle. We know the posterior triangle. We take the posterior triangle on the previous lecture, which are determined by sternocleidomastoid muscle, clavicle, and anterior border of trapezius muscle. These groups, which are superficial external jugular group, superficial external jugular group, and deep cervical group, superficial group and deep group. Deep group, which include internal jugular chain, upper, middle, and lower, and spinal accessory chain, and transverse cervical chain. I will show you the spinal accessory chain. These are spinal accessory chain. These are spinal accessory chain, transverse cervical chain, and internal jugular chain, these are two deep group, and these are superficial cervical group. These are submental, submandibular, parotid or parotid lymph nodes, okay, and postauricular lymph nodes. Also, these are preauricular lymph nodes, postauricular lymph nodes, and then occipital lymph nodes. All of these are drained into deep cervical lymph nodes. Anterior cervical lymph nodes, which are anterior jugular chain, and just a visceral chain, anterior jugular chain, and anterior here, which is located here, anterior, I will show you, anterior jugular chain, and just a visceral chain. This is located on the anterior part of the neck, okay, and the just a visceral chain, which divided into prelaryngeal, pretracheal, and paratracheal lymph nodes. These are prelaryngeal or laryngeal, sometimes tracheal, pretracheal, paratracheal nodes, and here is the anterior jugular chain or anterior cervical chain. According to the level, this is very very important subject. According to the level, it can be divided, the lymph nodes, according to the level, because this classification is important, especially during malignancy or during lymph node metastasis, when the tumor is transmitted to the lymph nodes and lymph node metastasis. So this is very important, especially in any malignancy in the in the head and neck and transmitted to the lymph node. So this will determine the treatment either surgical or treatment either medical, chemotherapy or radiotherapy. So it can be divided. So this is a classification is very important clinically. So it can be divided into levels, 7 levels. Level 1, which are submental, submandibular, and upper third jugular. Submental, submandibular, and upper third jugular. Okay? Sorry, level 1, just submental and submandibular. Just submental and submandibular. This is just level 1. Level 2, upper third jugular. Sorry. Level 2, upper third jugular. Level 3, as you can see here. Level 3, mid third jugular. Mid third jugular. I will show you. Mid third jugular. Okay. Level 4, lower third jugular lymph nodes. Level 5, posterior triangular groove, اللي هي spinal accessory and transverse cervical chain. Spinal accessory chain and transverse cervical chain. Okay. Level 6, which are pre-laryngeal, pre-tracheal and paratracheal lymph nodes. And level 7 here in the upper mediastinum, nodes in the upper mediastinum. So these levels are very, very important clinically and surgically, especially in any tumor determinations in the head and neck. So regional group, which are occipital lymph nodes. Occipital lymph nodes, I will show you on the, it's better to show you on this picture. Occipital lymph nodes. These are occipital lymph nodes which drain the nodes, the afferent nodes from the back of the scalp and also from the posterior part of the auricle. All this area which drain into occipital lymph nodes. Okay, occipital lymph nodes. The parotid, pre-auricular and parotid lymph nodes. As you can see, this area, the lateral part of the auricle and also the lateral part of the scalp, sometimes the forehead, okay, also the forehead and anterior part of the scalp, all of these drain into the parotid lymph nodes and also pre-auricular lymph nodes. Okay, pre-auricular lymph nodes. Then the mastoid, post-auricular. Here is the post-auricular lymph node, post-auricular lymph nodes, which drain into the back of the auricle, from the back of the auricle, and also from the lateral side of the scalp. Then submandibular lymph nodes. Submandibular drain the cheeks, nose, paranasal, sinuses, all the teeth except the incisor teeth. All the teeth except the incisor teeth. Also all the face except what? The lower part of the central part of the lower lip. Central part of the lower lip. Okay. Also the tongue except the tip of the tongue. All of this drain into and the floor of the mouth. Drain into submandibular lymph nodes, while the submental lymph nodes drain the afferent fibers, the afferent nodes or afferent regions, which drain the lower part of the central part of the lower lip, the skin over the cheeks, the tip of the tongue, and the incisors. All are drained into submental lymph nodes. Okay, drain into submental lymph nodes. And all of these lymph nodes which drain into deep cervical lymph nodes. All of these lymph nodes drain into deep cervical lymph nodes. So we explain that. Also, buccal lymph nodes along the facial. I will show you the buccal lymph node, which is located here, sometimes present, sometimes not present, which drain into where along the facial vein. This is buccal lymph nodes. As I said, submandibular. We explained that submental. This is submandibular lymph nodes, and this is submental group. Submental drain, submandibular drain all the face except the tip of the tongue, the incisor teeth, okay, the incisor teeth, and the skin over the chin, and the lower part of the lip. Also anterior cervical along the anterior jugular vein, which drain from the skin out fascia in front of the neck. Superficial cervical along the external jugular vein from the skin and fascia over the angle of the mandible, lobule of the ear and back of the neck. Retropharyngeal space between the pharynx and the prevertebral fascia, and afferent from the pharynx, auditory tube, sphenoidal sinus, prevertebral region, as I explained that. Also laryngeal, in front of the larynx, front of the infrahyoid bone, the afferent from the larynx and infrahyoid region. Tracheal, pre and paratracheal, in front and on each side of the trachea, afferent from the trachea and thyroid gland. Deep cervical lymph nodes embedded in the fascia of the carotid sheath along the internal jugular vein. Subdivision: jugular digastric group below posterior belly of the digastric muscle, jugular digastric, and jugular omohyoid group below intermediate tendon of digastric muscle, and efferent fibers from jugular lymph trunk that drain into thoracic or right lymphatic duct. Now, I want to show you briefly the examination of the neck, of the lymph node of the neck. So, as you can see here, the examination, as you can see here, is important. First of all, the examination is very important clinically. So you have to learn how to examine the lymph node of the neck. You should sit behind the patient, and as shown in this picture, the neck should be flexed and relaxed. Okay, so we have to examine systemically. They examine lymph node systemically. First of all, we have to examine submental lymph node, as I will show you in the next slides. Why we need to examine the lymph nodes? We need to examine lymph node, what we can see in the lymph nodes. First of all, the site, location of the lymph node. How many lymph nodes? Number of the lymph nodes. Size of the lymph node is very important, because greater than 1.5 centimeter, except in jugular digastric lymph node, level 1, 2, and 3. Okay? And also greater than 1 centimeter anywhere, any lymph node more than 1.5 centimeter, except jugular digastric area, or greater than 1 centimeter anywhere, it should be there is something, either infection or inflammation or sometimes tumors. Okay, so first of all, size, numbers, size, size, number. So the site, number, size, and also the another one is the consistency. شوف الكونسيستنسي محتوى مالتها. Because in case of metastatic lymph nodes, in case of a tumor, it will be hard, especially like lymphoma lymph nodes are firm or rubbery. Okay, like rubbery. And hyperplastic lymph nodes are soft. Nodes of metastatic melanoma and are also soft. So the consistency is very important in determination of the lesion. Also, is it discrete or matter؟ هل هي منفصلة أو مجتمعة؟ tenderness شوفها مؤلمة ولا لا؟ زين inflammatory lymph nodes are tender, while metastatic lymph node may be also painless. Fixity to the over skin or deeper tissues. Is it fixed to the skin or deep structure? Mobility, is it mobile or fixed? And should be checked. And also the mobility should be checked vertically and horizontally. The nodes are examined in the following manner so that no one is missed. Upper horizontal chain, external jugular chain, internal jugular chain, spinal accessory chain, transverse cervical chain, anterior jugular chain, and juxtavisceral chain. So, as you can see, we first of all examine submental, submandibular, preauricular, also post-auricular, occipital, and here jugular digastric lymph nodes. Okay, now superficial cervical chain, okay, now a deep cervical chain along this nucleosteroid muscle, jugular superficial cervical chain, deep cervical chain, okay, posterior cervical chain, and supraclavicular chain. This is very, very clear and very important. Here, submental lymph nodes. You can examine it by two maneuver, either by this maneuver or by from the back, and we can examine the submental lymph nodes. And this is submandibular nodes. Close your finger against inner surface of the mandible. شوفها get the inner surface of the mandible, and the patient head gently tilted toward one side. يعني تخليه على شوية tilted to one side. As you can see here, rolls your finger in front of the ear against the maxilla. This is parotid or preauricular lymph nodes. And here, what any lymph nodes? This is mastoid or post-auricular lymph nodes. And here is the cervical lymph nodes. And here is the external jugular chain. It lies superficial to the sternocleidomastoid muscle. External jugular chain. And internal jugular chain, examine the upper, middle, and lower group. Many of them lies deep to the sternocleidomastoid muscle, which may need to displace the sternocleidomastoid muscle, and we need to displace it posteriorly. Okay, here is the supraclavicular or Scalene lymph nodes, transverse cervical lymph nodes. Roll your finger gently behind the clavicles. Instruct the patient to cough or to bear down like they are having about movement. Okay, occasionally on enlarged lymph nodes. يعني من كأنما يعني you have to يعني ترفع اشتافات الثانيتين لفوق. Just the shoulder should be upwards, so that there will be a space, okay, a space on the clavicle. So this is supraclavicular or scalenus lymph nodes. So these are many acute or chronic lymphedema, transection of large lymphatic channels of the node, smaller channel area. Okay, and this is some clinical when acute or chronic lymphedema. The accumulation of the lymph node because of the section or damage to the lymph vessels. Okay, so this will lead to accumulations of fluids or edema or inflammation at the site of the site of injury. Okay, so we have to get drainage of the drainage pattern on the side and the fact that malignancy do not respect the midline. Malignancy do not respect the midline. يعني معناتها انه malignancy يتحول منيا من one side to the other side without any restriction. Okay, since cross communications between lymphatics may result in contralateral drainage, bilateral examination for lymphadenopathy should be undertaken before a neoplasm is excised. It means that we have to do bilateral examination. You should always compare. You should examine on both sides, especially in the lymph nodes, because sometimes the tumor in one side and the lymph nodes may be on the other side. And thank you very much.